Yes, ma'am.
So I have, as pointed out, I'm a professor of psychiatry. Let me start by giving you a brief difference between a psychologist and a psychiatrist, necessary when you approach for help for mental health. Psychiatrists are MBBS, MD psychiatry who deal with medication basically and some amount of counseling. It is our psychology friends who do more of counseling and therapy. But stress, either for you or for the general public or for psychiatrists and psychologists, stress for everybody remains the same. So when I talk of stress, I'll talk of it in general. And once I'm done, possibly in 20 minutes, I'll ask, please feel free to ask me whatever questions you have, and I'll try my best to answer.
Yeah.
And if I'm going too fast or you're not able to hear me, please do interrupt. So what times, if I ask all of you, what times do you feel stressed? I think the answer will be both day and night. It is true for all of us, right? From a school going child to an elderly struggling with dementia, all of us feel stress because challenges at different phases of life are different from us. So never go away with a feeling that stress is something specific to one individual, or that some children should not feel stress because they're too young. What do you know at your age about stress? हम कितने बड़े हो गए, हमारा हमको देखो, हमारे कितने problems हैं. So it is not like that. Stress is true for everybody. Now, what is exactly stress? When you face a situation which overwhelms you both physically and mentally, and you have to change according to the situation, it becomes stress. So if you are put in if from Sunday to Monday is a stress for a working individual, for a mother to wake up in the morning and cook for her children is a stress, though she deals with it very well. For a child to go to school and start the first class is stress, because everywhere the body is changing, the mind is changing from a place of rest and relaxation to having to be alert. So the entire body system biologically is at an alert to deal with whatever life is throwing our way. So this is stress. Now the question is stress bad? Many times we always equate stress as a kind of as a danger in our lives, or something which is bad, which should be avoided.
Okay,
Now, if you've seen the
at
Surf Excel ad which says daag achhe hain, similarly I'll tell you thoda stress acha hai. It is only when you are under a little bit of stress that you perform to your maximum. So when a student is stressed, he'll want to study. When a caregiver is slightly under stress, they'll be more alert to their ward's needs. And people like us doctors, when we are a little stressed, we are more alert to the changes in signs and symptoms a patient will tell us. Imagine you getting into a doctor's chamber. The doctor is all relaxed, and if you are, and you see the doctor chewing a pan or nicely laid back in his chair, would you trust the doctor and say, is this fellow going to listen to me or not? Or are you going to look at a doctor who looks concerned, is sitting a little ahead in his chair, leaning forward to catch everything that you say? So, जैसे थोड़े दाग अच्छे हैं, थोड़ा stress अच्छा है. The problem is when your functioning gets impaired, when you're all the time under stress to an extent that you're not able to perform to your optimum, this becomes distress. And that is what we are addressing today. So thoda stress acha hai, it wakes you from your sleep, makes you run towards your responsibilities and give your best. There will be a time when the stress becomes so overwhelming that function you can no longer function like that, and you start sliding downhill.
I'm so sorry,
and
power disruption.
Disorganized. So this is the stress that
No,
we
please
are
give her the
today.
rights.
Let's go quickly about some myths and facts about stress. Stress is bad. Like I just told you, no. There is some stress which is good called eustress, some stress which is bad, which is called distress. Negative events cause stress. Never be under the impression that something bad is going on in my life and therefore I'm stressed. Marriage is a stress, divorce is a stress, getting promoted is a stress, not getting promoted is a stress. Getting 99 on 100 is stressful for a very good student who worries about that 1 mark they did not get. So it's just not the negative events, but all events which make you change physically and mentally or challenge you physically and mentally are stressful events. Major events are stressful? No. So let's imagine, I don't know how many of you are from Hyderabad. So supposing you're in a major city, you wake up in the morning, you have to travel to say 50 kilometers to work, your maid is late, so therefore you are late. And then there's a lot of traffic. People are abusing you on the road because you try to move fast. You reach late, your HOD is scolding you, your principal is scolding you. What has happened? The entire process, starting from being late to getting up late from bed, getting late, getting delayed in all your activities, fighting with people on the road, little things have added up to become a huge thing by the end of the day. So never discount stress that comes in small packages. Stress can come from anywhere. Stress can come in all sizes, big and small. Minor stress can be ignored. Never make that mistake of thinking, I am stressed today, tomorrow will be okay. आज तो थोड़ा ही problem था, कल ठीक हो जाएगा. Never do that. Deal with your stress, finish your stress, and then go to bed. Caregiver stress in particular, caregiving is a highly rewarding process. My salutes to all of you for being such lovely caregivers. But caregiving for you as a person can be very emotionally and physically exhausting as well. Not just about the person that you're caring for, but you as a human being. So today in this session, let's just focus on you as a human being who is stretching himself or herself beyond your capacity to be there for the person you love. A very huge task, and therefore needs to be specially addressed so that if you are healthy, your child or your dependent is healthy. आप जब flight में जाते हो, there is always an announcement which says, put your oxygen in case of turbulence or in case there is a possibility of an accident, put your oxygen masks first before you help your child. This is true in life as well. As long as you're physically and mentally healthy, you can do a lot for the child who's dependent on you. So your physical and mental health needs to be prioritized, not only for yourself, but also for your dependent. Now, sources of stress differ, resources differ. When I started giving you examples, you must be thinking, "Arey, driving mein kya hai? Hum log har roz karte hain. Why is this madam talking of driving? I hate to drive. I am a bad driver. So for me, driving is stressful." You may be a fantastic Formula One racer. Aapke liye driving is a piece of cake. So it depends on what is stressful for you. My stress is not your stress. Your stress is not my stress. Therefore, let's not discount and say, "Arey, ye to choti si baat hai." This is a small thing. We can, I faced it so differently. I am being so brave about it. Why are you crumbling? Never say that to a person who's sharing their stressful things for you with you, because my stress and your stress are two different things. So the source may be same for all of us, but that is caregiving. But the resources each one is blessed with is completely different. Let's see how. Source, in your case, it is caring for someone who needs constant care. There may be financial constraints when you're going along with it. There may be poor accessibility to healthcare. You may have very insensitive doctors and health personnel around you who don't seem to respond to your worries as much as they should. Or you yourself have very poor coping skills and you have devoted your life so much to caregiving that you don't have time for yourself. And all this is coming in a life which is already stressful, life which throws at you bad neighbors, maybe you're a very bad work environment or ill health, mental and physical, you're already struggling with, you have these additional things also to take care of. So life stresses plus specific stresses of a caregiver makes it double, triple, and much more than that. So resources that all of us should have something called a hardiness in a personality. Now that is God given. Not necessarily you and me are the same. Now, some of you will be like, you'll face the toughest situations in life and you'll watch it off thinking, "Arey, koi baat nahi. I can deal with it." You're really blessed people. There are some people who are given a very small thing or small stress in life and they'll always be worrying, thinking कि देखो मेरे साथ ये हो गया, वो हो गया, इतना बड़ा हो गया. That is because their personalities are like that. Your biology is like that. Your brain is wired that way, right? So therefore, everybody does not have the same resources to fight with. Similarly, we also need, all of us, we should absolutely have these resources are social support, like this group which you are supporting each other so admirably. You should have extended families who are helping you. Should have friends who are helping you. You can share with, talk with, or if nothing, simply sit down and laugh with. Very essential to de-stress. Pets is also, if you like animals like I do, then pets are one of the greatest sources of de-stress. And a healthy body. It goes without saying that nobody can deal with any kind of mental stress unless and until you have a body that cooperates. You can't have knee joint pains. You can't have a perpetual headache. You can't have, say, breathing problems like asthma, and then you expect that I will deal with my stress fantastically well. So healthy body is very essential, and one quality we must all develop is optimism. This is right. Let me look at the silver lining in every cloud. Let me look for every window when a door is closed. So optimism is something which we can actually develop as a habit within our lives. How does stress look like? Stress did not be the same for all. Some may say when I'm stressed, I'm having headache. Some may say I'm having body aches. Some may say I'm worrying all the time. These thoughts don't leave my head. I'm all the time anxious. Some may say I'm so tired by the end of the day. All I want to do is sleep. Some may say I'm sleeping too much because I'm stressed. Like my mother is a very anxious lady. So whenever she's anxious, she'll say, I wish I had a razai and I could hide under that. So, and some like my father just go out head on and meet it. So everybody is different and everybody react to stress. Some may binge eat. When you're so stressed, you don't sleep at night. You start going into the kitchen to search for kya khaun ki mera stress thoda kam ho jaye. Because the carbohydrates, the sugar gives you a high and gives you temporary relief from your stress. You may get very angry and irritated easily. You may lose interest in activities. You may withdraw from yourself, not meet anybody, don't go out, don't interact, and you isolate, or you don't want to take your responsibility. Most people, especially the younger generation, what they're doing is using more and more phone every day. You know why they use? Because it's the best way to run away from reality, run away from life. So if many of us do that as well. Even worse, we will turn to, if not the internet, we will turn to alcohol, cigarettes, and other drugs. Some may have nervous habits like nail biting, pacing the room, and so on and so forth. So, and lots of physical issues. So stress in you and me does not look alike. One of the major points in stress management is to understand how your body or mind is reacting to the stress. Once you're able to understand that, chalo, ye mere ko stress ki wajah se ho raha hai, that is the time you will be able to correct it as well. Many of us, surprisingly, are not aware that these symptoms are coming to us because of the stress that we are going through. So how do we deal? Any situation, what do? We first look at a situation, then we get some emotions about it, and then we cope with it. So you can do it in a perfectly healthy manner, or you can do it in a perfectly unhealthy manner. So what is the healthy manner of doing things? So let's first look at how you look and how you feel. How you see a situation is exactly how you feel. Let's take an example. If you blame yourself for everything, you'll end up feeling guilty. If you are feeling helpless all the time, you will feel sadness. Do you know, and I'm sure you've heard this concept of learned helplessness. There are lots of, there's a big elephant you will see who's tied to a tiny chain and is still staying there and not being able to move, thinking that I cannot break this chain. Why? Because since childhood, this elephant calf was tied with big chains and could not move. So over the years, the elephant learned that I can't move when a chain is there. Similarly is in our lives. When we are dealing with the situation, if one time you felt helpless, you stop looking at other options, thinking that anyway I'm helpless. ये तो मेरे से होगा नहीं, मैं कर ही नहीं सकती. So this is called helplessness. And when you're helpless, naturally you're sad. And then you're uncertain. Oh no, God, what will happen? What can I do? Will I be able to solve it? What will happen tomorrow? When so much of uncertainty in the way you are looking at a situation, you will end up naturally feeling anxious. Therefore, what is a better way? Recognize your stress. This is my source, or ye yahan se aa raha hai. Face it and say, look, this is the way I'm going to face my stress. I am not going to run away. I am not going to drown my sorrows in a bottle of alcohol. I am not going to go into Instagram or WhatsApp and stop facing my problems. I am going to face it and I'm going to change the way I think about it. Is it so easy? No. Habits, form up on a lifetime. You remember your mother teaching you to brush your teeth? ऐसे करो वैसे करो, this way that way. You brush exactly like that at your 50th year, 60th year, till the day you die. You brush exactly like that because it's a habit. Unless you are consciously changing it. Similarly, if you have got a habit of thinking negative, this also becomes a habit and it's very difficult to change unless you identify it, you're aware of it, and make a conscious effort to change it. So, if every time you think as a caregiver, I have to be perfect, thoda bhi galti mujhse nahi hona chahiye, you will naturally feel burdened. But if you think it's okay to be imperfect, I'm trying my best, kabhi kabhi galti ho jati hai. Okay. So, in that time, you should be able to forgive yourself for small imperfections and accept that I'm a human being at the end of the day. Galti to insaan hi hoti hai. Then you think of, I have to solve it in a certain way only. Only when it is solved this way will I be able to solve it. Not a right thing to do because world is full of chances. If this is not the solution, something else will be a solution. I am being a little vague because your challenges I will never be able to understand completely. Please apply whatever the general themes I'm telling you to your everyday life challenges. Finally, I'm unhappy because of my problems. Really, are you unhappy because of your problems? Or are you unhappy because of the way you're thinking about your problems? Why don't you think, I am strong, I am brave, therefore God has given me this burden to carry. I will do the best I can. I will spread the maximum love that I can. And while I do that, I am going to keep myself healthy and happy. As compared to thinking, oh, why me? Why does it happen to me? Why am I burdened like this? Why doesn't it happen to everybody? Why is everybody happy? Why am I unhappy? So how you look is exactly how you feel.
Hello, ma'am.
Yes, yes.
Sorry for...
You're able to all hear me and you are all with me, right? I can't see anything else with the screen.
Yes, ma'am, we can hear you.
Yes, we can hear you very clearly.
Okay. So the other thing being emotions. Okay. Why are we talking of, now I have something has happened to my name. A minute. Yeah. Emotions, all of us have too many emotions, right? We are sometimes happy, we are sometimes unhappy, we sometimes are filled with so many emotions, we don't have anybody to share with also. Kisi se share kare? Even my partner is going through the same problem that I'm going through. So having a friend is very essential. If you don't have a friend you can talk to, please write about them. If you cannot write, sing about it. If you cannot sing, paint it. If you cannot paint, write in poetry. Why I'm giving you examples from my own patients. Children, adolescents who have been extremely stressed, extremely angry, and that anger they used to take out on themselves, cutting their hands and bleeding all over the place. So we tried to identify what is your strength and found out that some child loved to paint. Child, she was 19, 20. She loved to paint. So I said, next time you're so angry with life, paint, please. She would paint and give me such beautiful portraits, but all in different shades of black. So that was her anger coming out. If you want to write in a piece of paper, tear it and throw it, that's also one wonderful way of showing your emotions. So whenever there are emotions, please don't bottle them up. Bottled up emotions that you suppress, comes out as physical symptoms, worsens your physical problems. Okay. Coping is dealing with the situation. So you have thought in a certain way, you have felt in a certain way, now you're going to behave about it. So what are you going to behave? How are you going to behave? Unhealthy way would be naturally to strike out at others. You are very stressed that day, you shout at your maid, you shout at your spouse, you shout at your child, you shout at a person on the road, you shout at people working under you, and so on and so forth. Or you simply give up and say, ye mujhse nahi hoga and I'm done, and you simply withdraw from life. Or you deny and say, I don't have a problem at all. That also is very bad. Okay. Or you go on to drugs. So whatever that is that you're doing, if it is not leading to healthy conclusions, it is not okay. So how do you cope? Whenever you're faced with a problem, write it down, be aware of it, plan it, ask for help. If you're being too much pressurized from various directions, please learn to say a no, especially learn from experience and say, if I give this person a little chance, they'll keep on giving work to me. Please say low and draw lines, because it is your health that we're talking about, physical and mental, and see something positive in all your experiences. Daily life, laughter is definitely the best medicine. Learning to relax. It's so unfortunate that I have to put this up in red and say, you learn to relax. We are taught, learn to study, learn to sleep, learn to eat healthy, learn to talk to people politely. Nobody tells us it is okay to relax. Nobody teaches us that it is okay to put your burdens aside and simply be yourself for some time. Learning to relax is something that we actively need to learn, because we Indians sort of get very stressed when we are not doing anything. So I used to have this gentleman who was a software employee who was extremely stressed when he came to me. His father was in the military. He kept beating him every time he stopped studying. So, pura school se aana, till you sleep, you're continuously studying. If you're not studying in between, the father would come and tell him, you're a useless fellow, you're this and you're that. So, this fellow, this man, when he started doing an IT job and he would finish a project and would start, and there would be a few days gap for the next project, he would be extremely stressed because he thought he was being useless. Till he identified his father's voice in his head and decided, I am okay to relax. I don't have to feel guilty about relaxing. Like I already pointed out, please keep fit. Nothing beats a healthy body when you're dealing with stress. Accept change, believe in yourself. You're brave people who are dealing with a lot of challenges in life, and it is you who are keep giving courage to a lot of other people. So you have to believe that you are the pillar of strength, not only for yourself, your ward, and the society at large. And every occasion should be celebrated. Birthdays are a huge celebration. Everything should be about laughter, about music, about dance, about enjoying, cracking jokes, so to make memories. Also, please avoid all those people who talk negative in your life all the time. They are stress warriors, stress people, people who carry stress along with them wherever they go. Please avoid if you're not able to change them. And very important, hug yourself, praise yourself, tell yourself, I've done a fantastic job. Who will love you but yourself? Who will praise you but yourself? You look into the mirror every day in the morning, meet your eyes and say, well done, I have done a good thing today. Treat yourself to new things. Please don't forget to buy new things for yourself. If a good sari makes you feel beautiful, go ahead and do that. It is because when you're happy, you can keep others happy. Never have shame in asking for help. And finally, please practice mindfulness. Mindfulness is a relaxation technique which you will find in any YouTube channel, an excellent way to relax at the end of the day. So if you're able to find it, do it. Otherwise, ask me and I will send you the links. So conclusion is have adequate guilt-free me time. It's okay to have time only for yourself. There is no harm in taking away time from life, taking away from caregiving, and taking out time only for yourself, not with a lot of guilt and saying, Hai Ram, maine kya kar diya? I should have given more time to him or her. Why am I using it for myself? You are using it because you want to be strong enough to utilize the remaining time for your caregiving activities. What happens then? Finally, if you don't deal with your stress, what will happen if you don't deal with stress? You will get lots of physical problems, emotional problems, and psychiatric diseases. Physical problems, I'm sure all of you identify with this. When unrelated stress can lead to pains, muscle tension, you can feel your shoulders bunching up, you start getting headache at the end of the day. Some of you may get backache. These may be some indications that your body is under stress. Motion problems will be there, either diarrhea or constipation. You may have this constant nagging anxiety in the pit of your stomach, what we call the butterflies in the stomach. You may have this rapid heartbeat. You may have lose all interest in sex drive. You may fall prey to every illness that comes. Kisi ko bhi cold ho gaya, humko bhi ho gaya. That is because stress reduces your immunity, your ability to fight with diseases. So every virus and bacteria will find its way to you. So many emotional problems can come. I'm sure you identify with this. Stress can make you anxious, may make you angry, can prevent your proper concentration. It may make you feel isolated. You may want to run away from your problems and not solve them, and therefore keep postponing it. You may overthink a lot. You may eat a lot. You may sleep a lot, or you may not eat at all and lose weight, or you may not sleep at all and become a zombie. One very important thing that you should remember is stress by itself is solvable by you. Like you can apply all these methods that I told you, think different, feel different, talk different, have different activities, cope with it in a different way. But when you have to be aware of when it becomes a psychiatric disorder, that is the time when you need people like me to help you medically. Do not shy away from medications if necessary for your psychiatric disorders. This part I'll leave you open to questions, because I want you to understand what are psychiatric disorders. But just in brief, stress is something that you feel and then you get over it at the end of the day. Suppose the stress has changed to depression. There'll be lack of sleep, there'll be lack of appetite, there'll be low mood, lack of enjoyment, exactly like you're doing in stress. But now you'll no longer be able to function. आपसे काम नहीं हो पाएगा. You will no longer be able to do that caregiving or do any other roles in your life. All you are doing is surrounded by all these symptoms and become completely useless as a human being functionally. At least for 2 weeks, agar continuously raha, then you know that you have gotten into depression. Similarly, other psychiatric disorders. So whenever your functioning is impaired, you're not able to function to your optimum. You have gotten into a disorder which needs treatment. So take-home messages is stress is unavoidable. We can't stop. Not all stress is bad. It is good because it keeps you on your feet and active. Make sure that you're taking care of yourself by adding many buffers against stress in your life. But when you're dealing with stress, do it in a healthy manner. And if it has gone beyond the point, please feel no shame in asking for professional help. This is exactly why I told you the difference between a psychiatrist and a psychologist in the beginning. Psychologist is one who will counsel and help you deal with your problems when you're not able to deal yourself. When they feel that this problem has gone into the medical realm, this has become a psychiatric illness, is when a psychiatrist comes in and treats you